Now we're on to the third set of skills. And this is really crucial at this point because patients really need to know that we get it, that we get the impact of their symptoms, their story, their situation, their emotions on what's happening with them every day. And that's what this demonstration is about. And you'll see Ellen Singer and Mike Alberts do that in the video demonstration. The key here is summarizing the patient's stories and their worries. And a foundational way to do that, very straightforward, is actually to make a reflective statement. Some of you may not use that regularly, but it's important to get good at it. And let me explain how that happens. You can summarize what you've noticed, what you've heard from the patient, or even what you're picking up from them non-verbally. You process that in your head, and you can begin with a little starter phrase like sounds like or seems like. And then summarize what you've noticed and move your voice tone down at the end of what you say. And that makes a reflective statement. It can be the best vehicle for incorporating empathy into what you're trying to express to a patient. Remember, the studies show that patients think we're not all that empathic, and as clinicians, we think we are. Probably we're picking things up accurately, we're just not able to express it clearly to patients. And finally, a reflective statement can actually be more valuable for patients than reassurance. Reassurance has its place, but there's more than one study that show making an accurate reflective statement helps patients reduce their anxiety and their stress levels, and they can actually take more information in when they're not as anxious in a clinical visit.
The full list of skills for the next 2 weeks are: reflect an understanding of the patient's experience, acknowledge any worries or questions. For example, sounds like this has been hard on you. Summarize patient concerns, symptoms, and clinical necessities. Agree upon agenda. And finally, ask permission to transition to physical exam, procedure, or into a behavior change conversation. Keep an eye out during the demonstrations for things you might do differently than shown. You might also notice that not every skill is used every time. Some situations might not call for a skill, or a skill might just be forgotten. If you get in the habit of using the skills every time, it will become second nature.
It sounds like it's been a rough couple of days, or longer than that, you think?
Yeah, like a rough couple of months with the
Wow.
spring and everything, and I probably should have done something sooner, but.
So I'm going to log into your screen. Sadia had secured the computer for me, and let's just take a look and see. I want to verify your allergies with you because I noticed that you had a lot, and I want to make sure that if we're going to use anything, we've talked about them. So.
Okay.
And then when I looked in your chart and saw that in urgent care, they really just renewed your inhalers. But no one gave you prednisone or antibiotics or cough medicine or anything like that.
No, I've not had anything like that.
Okay. So if it's okay, I'd like to do an exam, and then we can talk about the best medications for you. But I wanted to make sure that I understood all of your sensitivities to medications.
I see, that must have been really painful.
It was horrible, and it's very embarrassing to even have to tell people what might be going on.
I could imagine. So it sounds like this came on suddenly, and you had a lot of pain with this, and you had to have it lanced. So you're here to talk about the options, conservative treatment, or even surgery.
That's correct. She told me I did have some options, and it would be better if I talked.
Would it be okay if we took a look at this?
Yes, absolutely.
Okay, I'm going to let you get into a gown. I'll step out for a moment, and I'll be back, and we'll take a peek at it.
Okay.